The first case example is a 48-year-old woman. I'll write this on the board while I talk to you guys about it. So she's 48. She has a red, dry tongue. She has a weak pulse. Her breasts are very tender prior to her menses. And she has actually palpable breast lumps. She's quite often depressed, and she has chest oppression. She feels kind of heaviness on her chest all of the time. It's as if somebody is pressing on her chest. And she thinks that she has shortness of breath when she goes upstairs. My diagnosis for this patient was that she had blood deficiency and she had qi stagnation. So I said that she had xue xu and qizhi, or blood deficiency and qi stagnation. It seems like a good starting point may be something like Siwutang or Xiaoyaosan. But since this patient is suffering from chest oppression and depression, already palpable gatherings of things, and tenderness, we can see that the qi isn't moving, but the qi isn't moving to such an extent that it's starting to create not just that idea of intangible yumen, or kind of, I like to say it's sort of angry Santa, just this kind of person, but it's starting to become tangible gatherings of blood, of phlegm, of toxicity, whatever you want to say, but it's no longer intangible. It's also tangible. In this situation, the thing I don't want to use is sour. I don't want to gather. I don't want to create any coming in for this person. Bai Xiao, it says that it tonifies the liver blood. It's supposed to soften the liver. What a great herb for somebody that is kind of angry and a little depressed and she's got blood deficiency. Bai Xiao would probably be in a formula for most people that would write this woman a formula based on actions, right? But sour is not what I want. So what I did, the very first thing when I see a patient like this, I think, what do I want to do? I want to disperse. And so what am I going to do? Obviously, I'm going to choose, I need acrid herbs. I want sweet because I want to build her blood. And sweet builds. So I want to build. So I want sweet. I want to cool a little bit because she's kind of irritable. So that's kind of self-explanatory. Cool. I want to cool herbs. What else? I might want to warm a little bit depending on how cool my herbs are. So these two I have to play with having a balance of cool herbs, warm herbs, not too cold, not too hot. So when I started off, and somebody was asking me, how do I diagnose, what's the process? And this is kind of the process that I do with my patients is I write down what they have and I think about, this is my diagnosis, this is what I want to do. So if I know that I want to disperse, then I know I want to use acrid herbs, and then I think about what herbs are acrid. And do I want acrid warm herbs because I need to warm the body and move things, or do I want acrid cool herbs because I want to cool the body and move things? Same thing with building. I know that sweet is going to build, and so instead of thinking herbs that build blood, I'm thinking herbs that are sweet will help build. So what I ended up coming up with is that Tianhua Fan is a good herb. Gualo. Gualo is, Tianhua Fan is gualo gun, is the root of gualo. So these are both going to be sweet and a little cool to kind of clear a little bit of, nourish some fluids. They're sweet. Guager is not a bad idea here because it's warm and acrid. It's going to help open the chest. It's going to help move some of this. And then the major thing here for her with acrid is I want Yujin. That's an acrid herb. I want Xiangfu. Sorry, Xiangfu. And I want Hopo. When I looked at these, this doesn't end up giving me very many herbs. So I thought, well, I also want to restrain the yin. I want to make sure that if I'm warming a little bit, I'm not damaging the yin. These are all pretty acrid and warm. I might damage the yin. I might want Junjumu because it's sweet and salty. It's going to protect the yin. It's not going to restrain. It might settle her a little bit. It might kind of calm her down. And I want to add Baidzaren because it also is neutral. It's sweet and it's going to moisten a little bit. Baidzaren. It's also going to help calm the spirit. So again, my starting place, my ending place is a little bit different, and I really went through what flavors and natures do I want to consider for this patient. And more importantly, what flavor and nature do I absolutely not want for this patient. Once I see that tangible, the less tangible kind of yuman, the qi constraint is a little bit better and resolved, then I might think about some other herbs, maybe some sour herbs, maybe something that's, if she doesn't have breast lumps anymore, then sour is a little bit less of kind of a warning flag or a danger. I'm going to be careful of too much acrid because she may not be able to handle too much dispersing. I could use a Suwutang formula with a slight modification. So shuri is also not a bad herb to consider. It's going to be sweet. Dangui, Yujin, Guager, Baidzaren, Gualo. Chaihu is maybe not a bad choice here also because it's cool and acrid. It's going to help to do some venting. So again, just looking at this from a flavor and nature perspective, you get something very different.